If you have knee arthritis, you have probably asked yourself this at some point. Am I helping my knee by walking, or am I slowly making it worse every time I take a step? Hi, I'm Dr. Megan Tomberlin, chiropractor here at Waves of Wellness in Leland, North Carolina. And this is one of the most common and important questions I hear in my office. A lot of people are told two completely opposite things. Some are told to stay active and keep walking. Others are told to rest and avoid putting stress on the joint. So which one is actually right? The truth is, walking can absolutely help knee arthritis, but only if it is done the right way, at the right amount, and with the right support around the joint. Before we get into how much walking is safe, I want to explain something important. Knee arthritis is not just about wear and tear. It is about how your joint moves, how your muscles support that movement, and how your body distributes load with every step you take. When someone comes into our office with knee pain, we do not just look at the knee. We assess how the hips are moving, how the ankles are functioning, how the muscles are firing, and how your body is handling weight and motion as a whole. Because many times the knee is not the only problem. It is just where you feel the pain. Now let's talk about walking. Walking is actually one of the best low-impact activities for knee arthritis. It helps circulate fluid in the joint, keeps the cartilage nourished, and maintains mobility. Completely avoiding movement often leads to more stiffness, more weakness, and more pain over time. But here is where people get into trouble. They either do too much too soon, or they push through pain that their body is clearly trying to warn them about. A good rule of thumb is this: mild discomfort during or after walking can be normal. Sharp pain, swelling that lingers, or pain that worsens the next day is a sign that your knee is not tolerating that level of activity. So how much walking is actually safe? For most people with knee arthritis, starting with shorter, consistent walks is much more effective than long, occasional ones. That might look like 10 to 15 minutes at a time, once or twice a day, and then gradually building from there based on how your body responds. Consistency matters more than intensity. And just as important as how much you walk is how well your body is prepared to walk. This is where treatment makes a big difference. In our clinic, we focus on improving how your knee moves and how it is supported. That may include gentle joint work, targeted muscle activation, and therapies like cold laser to help reduce inflammation and promote healing at a cellular level. Cold laser is especially helpful for arthritis because it works beneath the surface to improve circulation and reduce irritation in the joint without adding stress. We also incorporate simple strength work, not heavy or complicated exercises, but very specific movements that help stabilize the knee. Strengthening the muscles around the knee, especially the quadriceps and hips, can significantly reduce the load going directly into the joint. For some patients, I also use dry needling to release tight muscles and improve how those muscles function. When the surrounding muscles are less tense and more responsive, the knee often feels more stable and less painful during everyday activities like walking. All of this works together to make walking safer, more comfortable, and more effective for long-term relief. Another thing to keep in mind is your walking surface and footwear. Hard, uneven surfaces or worn-out shoes can increase stress on the knee. Small adjustments here can make a noticeable difference in how your knee feels during and after activity. If you are getting value from this and want more practical tips on managing pain and staying active, make sure to like this video and subscribe to our channel. We share simple, effective strategies to help you move better and feel better without unnecessary procedures. Now back to the big question. Walking is not the enemy when it comes to knee arthritis. In fact, avoiding movement is often what makes things worse. The key is guided, intentional movement that your body can handle and benefit from. If you are unsure where that line is for you, that is exactly where we come in. We help you understand what your knee can tolerate right now, what needs to improve, and how to safely build up your activity so you can stay mobile and independent. You should not have to guess whether you are helping or hurting your knee every time you go for a walk. We will take the time to evaluate your knee, explain what is going on, and create a plan that helps you move with more confidence and less pain. If knee pain is limiting your daily life, I invite you to take the next step. Call our office at 9108598359 to schedule your first appointment. We are located at 473 Old Waterford Way, Suite 118 in Leland, North Carolina, and we serve Leland and the surrounding communities.